Hi, it's Brian again. We're going to be talking about the vitamin and mineral supplements that you are expected to be taking after the surgery. The reason why vitamin and mineral supplements are so important after the surgery is because when you have the surgery, you're going to be having a lot less food, and with that, a greater risk of nutritional deficiencies. If you have something like the gastric bypass, that might also add malabsorption to the picture, which makes this even more important. You're going to be getting a packet either before and or after the surgery, and it's going to have handouts on the vitamin and mineral supplements. But just to make sure that everything is clear, I wanted to create this video to go over some things. So for the multivitamin, make sure that you have it twice a day. The reason for this is because we want to meet 200% of the daily value for vitamins that you should be having per day. In this multivitamin, make sure that it has 800 to 1,000 milligrams of folate per day. For some multivitamins, you can find iron. In prenatal vitamins, you're going to be finding more iron. So if you have regular periods or you're deficient in iron, the recommendation is to reach 45 to 60 milligrams of iron per day. For men, or if you're postmenopausal, iron in multivitamin may be sufficient. So you don't have to take more than what is in the multivitamin. As far as calcium is concerned, try to reach 1,200 to 1,500 milligrams per day. So if you're taking a 500 milligram tablet, make sure to take it 3 times a day. If you're taking a 600 milligram tablet, you can take it twice a day. And the calcium citrate can be found in liquid and chewable forms. It's also important to know that calcium and iron compete with each other when it's being absorbed into the body. So taking it 2 hours apart would mean that you have a greater chance of absorbing the supplements that you're taking. As far as B12 is concerned, it's on an as-needed basis. So based on what the labs show, if you're deficient in B12 over time or before the surgery, the recommendation is to either get sublingual or injection vitamin B12. And the amounts are listed over here. So 300 to 500 micrograms per day for the sublingual, and then for the injection, 1,000 micrograms for the injection over 4 to 6 weeks. So these vitamin and mineral supplements are extremely important, mandatory for the rest of your life. It's not something that you take until you feel better, or something that you take when the sun is out. It's something that you're taking for the rest of your life. And the reason for this is because certain procedures reduce absorption of these nutrients. And also, as I said in the beginning, because less food is eaten, it may be difficult to consume the recommended amount of nutrients. And also, certain antacids and medications might reduce the absorption of nutritional supplements or the nutrition that you're eating. So it's really important to supplement. So in summary, outside of the vitamin and minerals, if you want long-term successful weight management, make sure to eat slow and chew well. Stop eating at the first sign of fullness. Eat a diet that is low in added sugar and fat, but high in high-quality protein. Getting about 3 to 6 meals. 3 to 6 meals and snacks. 6 would be probably preferable in the beginning because you're just getting used to having a smaller stomach, and each of these meals might last 15 to 20 minutes. Avoid repetitive snacking or grazing, so no eating in between meals. The reason for this is because it could be classified as mindless eating or not paying attention to your hunger and fullness cues. Also, the whole point of this video was to talk about daily vitamin and mineral supplements, so make sure to take that. Avoid carbonated beverages and sugary drinks. Follow up long-term with the bariatric team. Take advantage of the services that are available. Make sure to ask questions if you have any or concerns, and maintain a healthy lifestyle and be active after the surgery. So this is the table that you'll find in the packet that you might be getting before, during, or after the surgery. It's going to list the multivitamin, the calcium, and the iron, and also maybe some products that are out on the market that you can also get these supplements from. And that's vitamins and minerals.